Welcome back. You're listening to the Cindy Laverty Show on CRN Digital Talk Radio. Thanks for staying with us today. I'm talking to Dr. Vicki Rackner, and we're discussing the topic of chronic pain and how, as a family caregiver or a friend or a spouse, you could help support and make some positive impact in that area of their lives. Thank you for being with me, Dr. Vicki.
Thank you for having me.
Okay, so I want to talk about how I think, this is my personal opinion, I just want to know how you feel about it. I think in today's stressed out society where you might have, 7 to 10 minutes with a doctor, how can people be more proactive in their own health care, even if you're in chronic pain?
Especially if you're in chronic pain.
Okay.
And what I recommend is approaching a doctor appointment like a business meeting.
Oh, I couldn't agree with you more.
So have your objectives. Know what it is that you want. And generally, people want a couple of different things. And here are the main ones. You want a diagnosis. You want to know what is causing this pain. You want a plan. You want to be educated, or you just want to be heard. You just want to know that you're not alone, even if the doctor can't fix it. And
Right.
if you have a clear idea about what you would like when you go in, you're going to have a much better chance of leaving satisfied.
Don't you think people should write down what their questions are, what their concerns are, so that they're just very succinct in the approach? I mean, doctors are really overworked these days.
Yeah. You know, I think we're in an interesting time where the whole nature of the doctor-patient relationship is changing. I mean, historically, when I was a kid, the doctor was the god.
Oh, yeah, absolutely.
And
absolutely.
Whatever the doctor said went. But we're at a time when the doctor-patient relationship is looking more like adult-adult collaboration.
Mm-hmm.
And it's hard to make that change.
But don't you think, do you think doctors appreciate a patient who is their own personal advocate when it comes to medical care?
Absolutely. Let me tell you this. Doctors want to make patients happy.
Mm-hmm.
They want patients' needs to be met, but they're not mind readers. So you are actually helping your doctor if you let them know what it is that's important to you, because that means that both of you are going to leave the exam room more satisfied.
Right, right. And I think it's a lot about what your attitude is when you walk in that door also. I mean, I hear so many people say, my doctor doesn't give me any time. I go, how many patients does your doctor have to see a day? They never even think about that.
Yeah, and if they want more time, they can get it. If you know what it is you want, you can get it. So if the appointment is too short, here's what you do. You call the receptionist and say, look, I'd like to schedule a 15-minute appointment, and then they'll tell you why that can't happen. And then you say, well, I know it's possible, and if you'd like, I'd be willing to pay out of pocket for this time.
Well, isn't that the big question mark there? I'd be willing to pay for a doctor appointment. I mean, we have to do that.
Yes, yes. So you can get what you want. It might be a creative solution, but there's always a way of getting what it is that you want and need from your doctor.
Right. Okay. You talk about how there are 5 pain personalities.
Right. So when I did my operations, I noticed that there were certain patterns that I saw. And what I figured out is that people have different pain personalities. Just kind of like people have different eye colors, they have different ways that they're wired to respond to pain. So
I'm sure this is true. I think this is fascinating.
Okay, so the first is a strong stoic. I live in Seattle with a lot of hardy Scandinavians. So these strong stoics are the people who take pride in being healthy, and there's some shame about being sick.
That's kind of our World War II generation also.
Exactly.
Yeah.
So they wait way, way too long to go to the doctor. They have to practically be dying before they go to the doctor.
Right.
Then there's the worried well. Those are the people, and I'm one of these. They used to be called hypochondriacs. Now they're sometimes called cyberchondriacs. They hear about 2 symptoms, and they've got the disease. I remember one time I was studying in medical school for an exam, and I read about this weird pancreatic tumor that was fatal, and I didn't think I should even study because I was going to be dead in 6 months.
Okay.
So this is a problem, too. Next, there's the ostrich. This is the person...
Denial.
Exactly. This is a person who's popping Tums for the heart attack. Then there's the victim, and The victim
Why
is the
me?
person. No, not just that. It's I say I want to get better, but I am my pain. Like, who am I if I don't have my pain and my painful story?
Oh, that's very interesting. Now, I would have thought that would have been the hypochondriac, but you're right. It's the victim mentality.
Right. The
It's the Debbie Downer.
Exactly. Exactly.
Nobody wants to be a Debbie Downer.
Right. And then there's the perfect responder, that person who just is in touch with their body. They know what's going on. They seem to call at exactly the right time. And let me just say this. I did a lot of breast surgery.
Mm-hmm.
And when a woman came to me for an abnormal mammogram or a breast lump, before I even examined her, I would ask her, well, what do you think this is? Do you think this is a little nothing, or do you think this is something serious? And almost 100% of women were able to predict whether or not they had breast cancer.
Really?
So we have this intuitive voice that knows what's going on. And so the beauty of knowing your pain personality is you can adjust the way you respond to the pain so that you're getting the good result. Like, I know as a worried well that I'm always going to be worried. So what I do is I have this person who's a voice of reason for me, who I can just call and say, I'm at it again, I think I'm dying, talk some sense into me.
Okay, so it's about wrapping your head around what your personality is surrounding your wellness and your disease, your dis-ease, correct?
Exactly. It's kind of like the tennis serve. You know where your serve tends to go, so you can adjust
out
your
of the
swing.
court.
Yeah, you want it in the court. You want it in the sweet zone.
All right, I got to take a quick break. You're listening to Cindy Laverty Show. I'll be right back with Dr. Vicki Rackner.